Fragmin Vial, also known as Dalteparin, is a medication used to treat and prevent harmful blood clots. This helps to reduce the risk of a stroke or heart attack by keeping the blood flowing smoothly and lowering the activity of clotting proteins in the blood. Fragmin Vial is a type of heparin and works as an anticoagulant, commonly known as a blood thinner. People who have had certain types of surgeries, such as hip replacement or abdominal surgery, are at risk of developing blood clots. Also, those who have been immobile for long periods of time, or have certain types of heart attack or unstable angina, may benefit from using Fragmin Vial. In some cases, Fragmin Vial may be used in combination with other blood thinners for certain medical conditions. Additionally, Fragmin Vial may also be used to treat and prevent clots from recurring in patients with cancer. It is important to follow the prescribed dosage and take Fragmin Vial at the optimal timing recommended by your healthcare provider for the best results. Before starting to use Fragmin Vial, it's important to read the patient information leaflet from your pharmacist. This medication is given by injection under the skin as directed by your doctor, usually once or twice daily. The dosage and length of treatment are based on your medical condition and response to treatment. It may also be given by injection into a vein by a healthcare professional for certain conditions. If you are using this medication at home, learn all preparation and usage instructions from your healthcare professional and the product package. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. This medication should not be mixed with or added to any other medication. To prevent blood clots due to surgery, your doctor may direct you to start using this medication before or after surgery and continue for several days. Use this medication regularly to get the most benefit from it, and try to use it at the same times each day. It's important to be aware of the potential side effects of Fragmin Vial. You may experience irritation, bruising, or pain at the injection site. If these effects persist or worsen, it's important to notify your doctor or pharmacist. Remember, your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, Fragmin Vial can cause bleeding if it affects your blood clotting proteins too much. It's important to seek medical attention if you experience serious signs of bleeding, such as unusual pain, swelling, or discomfort, prolonged bleeding, easy bruising, dark urine, black stools, severe headache, confusion, vision changes, dizziness, fainting, seizures, weakness, or numbness. While a serious allergic reaction to this drug is rare, it's crucial to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. When using Fragmin Vial, it is important to be aware of the potential risk of bleeding near the spinal cord after certain spinal procedures. This type of bleeding can lead to long-lasting or even permanent paralysis. Before undergoing any spinal procedure, it is crucial to discuss the benefits and risks with your doctor. They may instruct you to stop taking Fragmin for a specific period of time before and after the procedure, so it's important to carefully follow their directions. The risk of bleeding may be higher for individuals with a deformed spine, a history of spinal procedures or surgery, or those taking other medications that can increase the risk of bleeding or bruising. These medications include antiplatelet drugs like clopidogrel, blood thinners such as warfarin or rivaroxaban, and nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen. If you experience symptoms such as back pain, leg numbness, tingling, weakness, or loss of control of the bowels or bladder, incontinence, it is important to inform your doctor immediately. Before using Fragmin Vial, make sure to inform your doctor or pharmacist if you are allergic to dalteparin, heparins, pork products, or any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have serious active bleeding, artificial heart valves, bleeding or blood disorders, certain eye problems, high blood pressure, heart infection, kidney disease, liver disease, low platelet counts after previous heparin treatment, stomach/intestinal problems, stroke, recent spinal procedures or puncture, spine problems, or recent eye/brain/spinal cord surgery. While using Fragmin Vial, it's best to limit alcohol consumption to reduce the risk of stomach bleeding. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. To lower the chance of getting cut, bruised, or injured, use caution with sharp objects like razors and nail cutters, and avoid activities such as contact sports. Older adults may be more sensitive to the side effects of this drug, especially bleeding. If you are pregnant, Fragmin Vial should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. This medication also passes into breast milk, so consult your doctor before breastfeeding. When taking Fragmin Vial, it's important to be aware of potential drug interactions that may affect how the medication works or increase the risk of serious side effects. This can include interactions with other blood-thinning or antiplatelet medications, such as aspirin, clopidogrel, or warfarin. If your doctor prescribes a combination of these medications, you will need to be closely monitored to reduce the risk of bleeding. It's crucial to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist to ensure the safe use of Fragmin Vial. Additionally, be sure to carefully check the labels of all prescription and over-the-counter medications, as some pain relievers and fever reducers, such as ibuprofen, naproxen, or aspirin, can increase the risk of bleeding or antiplatelet effects when used with Dalteparin. If your doctor has prescribed low-dose aspirin for heart attack or stroke prevention, it's important to continue taking it as directed unless otherwise instructed. It's also essential to attend all medical and lab appointments and to ask your doctor or pharmacist for more information if needed. If someone takes too much Fragmin Vial and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222. In Canada, you can call your provincial Poison Control Center. Symptoms of an overdose may include excessive bleeding and bruising. Remember, it's important to use Fragmin Vial exactly as prescribed by your doctor to avoid any potential risks. It's important not to share Fragmin Vial with others. Your doctor may also want to do some lab or medical tests while you are using this medication, such as a complete blood count or anti-factor XA blood levels. Make sure to keep all your medical and lab appointments, and consult your doctor for more details. If you happen to forget a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. When storing Fragmin Vial, make sure to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. If you are using a multiple dose vial, you can store it at room temperature for up to 2 weeks after the first use. Remember to discard it after 2 weeks to ensure safety and effectiveness. Properly dispose of any expired or unused Fragmin Vial by consulting your pharmacist or local waste disposal company. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. It's important to follow the proper guidelines for disposal to protect the environment and prevent any potential harm. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.